Hello, everyone, and welcome back to the OET Speaking Practice Podcast. This podcast is designed to help healthcare professionals prepare for the OET speaking subtest, particularly the medicine role play. Our goal is to help you understand what the task is asking, how to structure your response, and how a high-scoring conversation sounds in real time. In each episode, we'll first set the scene by introducing a role-play scenario commonly seen in OET-style speaking practice. After that, you'll hear a model conversation between a healthcare professional and a patient or carer. This is Episode 7, and today's episode focuses on a 4-year-old child presenting to the emergency department with vomiting and fever, later diagnosed with a urinary tract infection. Here is the exam context. You are the doctor working in the emergency department. A parent has brought in their 4-year-old daughter with a 10-hour history of vomiting and fever. The child has already been triaged and a urine test has been taken. Preliminary results show leukocytes in the urine, suggesting infection. The child is not present during this discussion. Your tasks as the doctor are to ask about other symptoms, such as abdominal pain or diarrhea. Explore recent toileting history. Explain the likely diagnosis of urinary tract infection. Justify the diagnosis clearly. Outline the management plan, including hospital admission. Explain the expected length of stay and next steps. Address the parent's concerns and questions. Now, let's move into the sample OET role-play conversation. Hello, I understand your daughter has been unwell. I've reviewed the nurse's notes and test results. Before I explain further, could you tell me how she's been since last night?
She just had a slight stomach ache last night, but no diarrhea.
Thank you. Has she had any changes in her toilet habits recently?
Yes. She recently started using the toilet by herself, and I haven't been paying close attention to her habits.
That's useful to know. Based on the urine test we did, we found leukocytes, white blood cells, which strongly suggests a urinary tract infection. This could explain her fever and vomiting.
I see, but I don't think that's the right diagnosis. I thought it might be gastroenteritis since her friend had it recently.
That's a reasonable thought. However, gastroenteritis usually causes diarrhea, which your daughter doesn't have. Also, the urine test supports infection in the urinary tract. To be sure, we've sent her urine for culture, and that will confirm the exact bacteria.
Okay, I'm glad she's being treated. How long will she need to stay in hospital?
She'll need at least 2 days in hospital for intravenous antibiotics and close monitoring. If she responds well, she may go home after that, but sometimes children need to stay a little longer.
All right. I'll call a family member to bring an overnight bag so I can stay with her.
That's perfect. We encourage parents to stay, as it helps children feel safe. For now, she'll be given IV antibiotics, fluids to keep her hydrated, and careful observation in the pediatric ward.
Thank you, doctor. I feel reassured now.
You're welcome. If you have any other concerns or notice any new symptoms, please let the nursing staff know right away. Thank you for listening to today's OET Speaking Practice Podcast. As you listen and practice, focus on clear structure, empathetic communication, and simple, patient-friendly language. Try practicing this role play aloud, switching roles if possible, and timing yourself to match exam conditions. We hope this episode helps you feel more confident and prepared for your OET speaking test. Good luck with your preparation, and we'll see you in the next episode.